I'm Veronica Marshall at the Capitol. This week on Senate Spotlight, as everyday costs continue to climb, the pressure on Minnesota families and their budgets keeps growing too.
As you start to add all these costs together, all of a sudden the price tag becomes substantial.
We need to address the affordability crisis. We need to do it comprehensively and across the board.
Legislators look for new ways to provide financial relief, like addressing the issues impacting housing affordability across the state.
As new construction costs go up, it drives the price of existing homes up as well.
Plus,
healthcare in America is in crisis almost at every stage of the delivery system. Hospitals, clinics, physicians, insurance. But the one area that's doing very well in the healthcare delivery market is Big Pharma.
How senators are stepping up enforcement efforts in the pharmaceutical industry to lower healthcare costs for patients and providers. That's all coming up.
Senate Spotlight is produced by the Minnesota Senate and Senate Media Services.
Healthcare affordability remains a consistent and growing concern for Minnesota families, employers, and taxpayers. It's one of the key takeaways from a new Minnesota Department of Health report. The report also finds healthcare spending growth continues to outpace wage growth, leading to difficult choices for Minnesotans. For instance, nearly a quarter of Minnesotans say they've skipped out on care because of the cost. Now, Senator Matt Klein tells me about the work he's done this session to lower the high cost of healthcare. Senator, thank you for being here.
Veronica, it's such a privilege. Thanks so much.
I'm excited to meet you and to talk about this very important topic, which is healthcare affordability. We keep hearing in Minnesota we have this affordability crisis, and obviously healthcare plays a role in that. You're a doctor, so you see this firsthand. What are you hearing and seeing?
I'm hearing it from my patients every single day, and it's at every level and every demographic in Minnesota. So if you're a person on Medicare, often you can't afford your Medicare Advantage plan in this day and age, and it doesn't give you very good coverage. If you're an independent purchaser of the healthcare market, like a farmer or a small business owner, we've seen the termination of advanced premium tax credits at the federal level, so those prices are going up by 40%. And then there's going to come this coming year a $1 trillion cut in medical assistance, which is going to affect every hospital, every clinic in the state of Minnesota, from my old alma mater, downtown Minneapolis, Hennepin County Medical Center, to rural hospitals in Alexandria and Northfield. And so we need to address the affordability crisis. We need to do it comprehensively and across the board and make sure Minnesotans have access to health care.
That sounds scary and adds a lot of urgency to this. To that end, you've introduced several pieces of legislation this session to address affordability, one of them being Senate File 3769, which is bipartisan. It's the 340B drug pricing program. I'd never heard of it before, so tell me about it.
Well, usually when you start talking about 340B, people's eyes glaze over because it sounds very bookish, but I'll tell you what it is. It's a federal program, and it's a good one that said pharmaceutical companies need to provide our safety net hospitals with low-cost medications so that individuals in Minnesota have access to affordable meds. A few years ago, Big Pharma just started ignoring the federal law, and they weren't providing these low-cost medications to our Hennepin County Medical Center, to North Memorial, to Essentia hospitals, and hospitals as a result were losing a lot of money, and it was threatening their bottom line. We passed a bill a couple years ago that said you've got to obey the federal law, but Big Pharma continued to ignore it. So this year we had a bill that gave the Attorney General power to enforce that law, and in other states where they've done that, Big Pharma has finally toed the line.
Talk to me about that. You know, you've said it holds Big Pharma accountable. What would the Attorney General do?
You know, I think what we've seen in other states is just knowing that the Attorney General has power to prosecute and bring cases has forced Big Pharma to obey the law. So it's just the threat, honestly, of his capacity to hold them to civil litigation that enforces compliance.
That makes me chuckle. It makes me think of a parent be like, if you do this, and then they're like, okay, I won't. Talk to me about how this could improve affordability. Would it trickle down to patients?
It really does. You know, if you're a patient, again, that's going to a safety net hospital and you get discharged on a blood pressure medication, that medication is going to be more accessible and more affordable and at many pharmacies for you than it would be if pharma continues to ignore 340B. So We know that drug prices are a big affordability crisis in and of themselves. Here in Minnesota, a couple years ago, we passed a prescription drug affordability board that'll give the state of Minnesota power to regulate drug prices if they go up excessively. I continue to believe at the federal level we should be negotiating drug prices on all drugs covered by Medicare, and we should regulate drug prices a little more aggressively. Healthcare in America is in crisis almost at every stage of the delivery system: hospitals, clinics, physicians, insurance. But the one area that's doing very well in the healthcare delivery market is Big Pharma. They're doing very well. And so we need to sort of spread the wealth a little bit and make sure that our patients have access to good medications.
You've talked about how this is for our rural pharmacies and our safety net facilities. We know that Hennepin County Medical Center is having some financial strain. Could this be part of a longer-term solution to that problem HCMC is facing?
Well, you know that I practiced for about 15 years. I worked nights at Hennepin County Medical Center. It was a passion project. I loved it very much. I was always inspired to walk through those doors. It is a Minnesota institution, a gem. We train good doctors there. We give good care, and I think it's one of the best aspects of who we are as Minnesotans. I'm intent this session, in my final session here at the legislature, on saving HCMC, and yes, 340B is an essential part of that. They cannot lose those dollars. But we do need a bigger solution, and we're going to work on some statewide resources to direct to not just Hennepin County Medical Center, but to sustain all our hospitals, our rural hospitals that are struggling, and North Memorial and Essentia. And so I think Minnesotans know that sustaining our hospitals is essential to who we are and caring for each other well, and we're going to try to get that done in the final 4 weeks here.
So your bill on the 340B drug pricing program passed with a 42 to 24 vote, which we love because that shows some bipartisan buy-in. The idea was welcomed by both caucuses, but it was debated on the floor for nearly 2 hours. If there was a main concern that was brought up during that debate, what was it?
Well, it was not only passed in a bipartisan way, but it had bipartisan authorship, so I was proud of that. I think what you saw in the lead up to that vote was that Big Pharma was spending upwards of $1 million a day on television advertising. They were really opposed to this law. And you know, they have a powerful lobbying capacity, and I'm really impressed that we were able to muster the 42 votes. I think the 2-hour debate was a reflection of the fact that they had spent a lot of time and energy lobbying individual legislators to try to shut this program down. But at the end of the day, Minnesota legislators know what's good for Minnesotans, and they were able to pass this in a bipartisan way.
Do you think there's still room to improve this program on a state level?
You know, it's a good program. I think it's worked for 30 years the way it should be, and I think we should keep it going and make sure that it's enforced appropriately.
If it goes into law, assuming the governor, goes forward with it as well, how soon could it start having an impact?
Well, you know, it could start having an impact immediately because, if they're currently not fulfilling their obligations under federal law to sustain 340B payments, and then they start to do so, I think hospitals like Hennepin County Medical Center will notice the difference on day one. So I'm hopeful the governor can get this signed in the next couple of weeks here.
That's great. We need that now. You've also authored Senate File 3859, which would create a vaccine advisory council here in Minnesota. Why do we need that?
So there used to be a very legitimate and austere vaccine advisory council at the federal level, and it was gutted. All 17 of its members were fired by RFK Jr., and he replaced them with conspiracy theorists and his cronies. And their advice is not based in science and is not reputable. We need to recreate that. We have good medical resources here in Minnesota with the University of Minnesota and with Mayo Clinic, and I thought it would be wise if we got together those resources and those voices to give Minnesotans the best possible advice on what good science-based vaccine practices are. At the end of the day, it's an individual's decision what vaccine they want to take or what they want to have their kid take, but we thought they should have at least access to reliable information based in science on what the best advice is, and we're going to try to set that up in Minnesota.
I remember hearing when this bill was being debated that it's not requiring anyone to have vaccines. It's just giving them access to information and recommendations, because I know that was a fear, right? People don't like being required to do things. But on that note, Minnesota is the fourth worst state in the country when it comes to childhood vaccinations. So how did we get here?
Well, you remember the candidacy of Dr. Scott Jensen just a couple years ago, who ran for governor and really ran on an anti-vaccine type of agenda and spread misinformation during that time about the the COVID vaccine and mRNA vaccines in general, which are some of the greatest scientific advancements in health in the last couple of decades. And so I think he really poisoned the waters for us a little bit. RFK Jr. obviously fed right into that same narrative. We need people who are educated in science to sort of stand up against misinformation, use their voices, use their platforms to make sure Minnesotans have access to the best possible advice. The other interesting thing about the vaccine bill is not only does it sort of give good science-based recommendations on vaccine policy, but it also requires that insurance companies cover those recommended vaccines.
Right, and that's how it ties back into affordability, which is what we're all looking for. You said that this could help clear up misinformation around vaccines, but how do we do that? How do we reach and connect with the people that have those questions or concerns?
You know, it's tougher in today's environment. We have so many media sources, and people tend to polarize towards the media sources that affirm their preconceived biases. And we're all guilty of that. But I think just simply setting up something that truly is nonpartisan, non-political, based in what the best medical evidence has to give us, is at least putting it out there for Minnesotans to seek out if they so choose. That's, I think, the best we can do in this moment, is to offer the truth, have it available to people, and if they choose to follow a different pathway, that is certainly their prerogative, but at least they'll have access to it.
I want to turn now to a bill that isn't yours, but you've supported it. It's Senate File 3650, which is a bipartisan bill authored by Senator Draheim, which would ban direct-to-consumer advertising of prescription drugs. Now, aside from seeing so many commercials for that, where's the harm? You
know, it's interesting. I hear a lot of anger about this from Minnesotans when I meet with them in town halls and so forth, because people go to the pharmacy and they can barely afford to fill their prescriptions, say, for rheumatoid arthritis or for high blood pressure. And yet they sit and watch television in the evening and they see these hugely expensive produced medication ads, and they see that a lot of the money they're spending to try to take care of their health is going to produce these fancy commercials. So that's the first part about it. It is raising the costs of pharmaceuticals and it's not helping patients. And the second part about it is direct-to-consumer advertising sort of bypasses the physician, bypasses that gatekeeper for what good advice is medically, and sort of could influence patients to pursue bad medical treatment.
And how could that tie into affordability?
I definitely think if we could regulate and limit the amount, so medical companies, pharmaceutical companies are supposed to be using their money on research and development, developing new medications, bringing them to market, improving them once they're out there. To the extent that they are spending a large portion of their budgets promoting those products on television, on the internet, that's raising costs for Minnesotans without any real benefit to Minnesotans.
All right. Well, Senator, this has been a great conversation. Thank you for your time.
I'm so honored, and thanks for having me on again.
Absolutely. Minnesotans could soon see better outcomes for both their health and their wallets.
When people work for somebody and they have insurance, they say, oh, good, I got insurance. And, oh, it's $1,000 a month. I thought it would be cheaper. And I have a $5,000 deductible? Really? So we're $17,000 into first dollar coverage. And they're very surprised by that. So they really don't have insurance, and so people are neglecting the ongoing care.
During the floor debate for the Health and Human Services Omnibus Bill, Senate File 3295, Senator Jim Abler presented the A14 amendment. The amendment creates a legal framework for direct primary care arrangements in Minnesota. That's when patients set up payment agreements with providers of their choice. It's like a primary care subscription service for patients, where they pay a flat monthly fee. In addition to cutting costs, supporters say the agreements give patients more access to their doctors.
If we really want choice and flexibility, this is a program that will work. It's been done many places.
I think the concept of direct primary care is one that we should discuss and explore. I do think that it is really important for consumers to understand the limitations of a direct primary care agreement. And so if someone wants to do this, I think they need to be very fully informed that they will likely need some other form of health insurance to go along with it.
What this would provide would be a way for a person to keep their high deductible plan and at least now have a way to see a clinician without having to pay total cash, which is now what they're in, and they actually could get some continuity of care.
Both the amendment and the omnibus bill passed. They now wait to be reconciled with the House's version of the bill.
We all know property taxes are going up across Minnesota, and for many families, this is not just one bill. In addition to property taxes, it's utilities, groceries, insurance. Everything is moving in the same direction.
That direction is up and out of reach, according to Senator Grant Hochschild. But property tax relief in the form of a refund could soon be on the way. Minnesota ranks above the national average in property taxes, and the latest estimates from the Department of Revenue show that local governments across the state are proposing up to $948 million more in property tax levies for 2026 than owners paid last year. To ease the burden on Minnesota's homeowners, Senator Hochschild put forth Senate File 5010. The bill would enact a one-time 12% increase to the state's homestead credit refund. This would be for taxes payable in 2026, and the average homeowner could see their refund increase by about $171. Senator Hochschild told the Taxes Committee it provides fast relief for Minnesotans struggling with rising costs.
It keeps eligibility tied to income and targets relief to middle to low income Minnesotans who are feeling those increases most.
The bill was laid over for future inclusion in the Senate's tax bill. Property taxes are just one part of the equation when it comes to solving Minnesota's affordability and housing problems. The state also has a severe shortage of affordable housing. According to the Minnesota Housing Finance Agency, the state needs to build 182,000 new housing units within the next 10 years to create and sustain a healthy housing market. There's just one problem with that. Senator Bill Weber says the soft costs of development make it hard to improve affordability. Senator, thank you for being here.
You're most welcome. Glad to do so.
I know you work in real estate outside of here, so you're very familiar with the conversation, the issues, the players. So what are you hearing about the need for more housing here in Minnesota?
Well, I think housing is an issue whether you're in Metro, whether you're in greater Minnesota. It really doesn't matter. There's a lack of housing and many times a lack of affordable housing. I mean, we have seen costs or values of homes increase at such a rapid rate in recent years. Part of that, of course, is due to the cost of new construction. As new construction costs go up, it drives the price of existing homes up as well. And so it makes it much more difficult for a young person to get into the housing ownership situation. And at the end of the day, we always have to remember that the home is one of the greatest opportunities for an individual to build equity and start to build wealth. And it's important that people have the opportunity to invest in a home. And so we need to work at every level of government to say, okay, what are we doing to impede people from getting into home ownership?
You're saying soft costs are impeding that. So what are those? That's not a term I'm familiar with.
Well, soft costs are those regulatory costs that come into play that might add costs to financing, add costs to development. If you add costs to development, now you're raising the price of the lot for an individual to buy and on which to build a new home. If you're also looking at some of the building codes, you know, as we add things there that make it more restrictive or make it more expensive to build a house. And obviously building codes are intended to provide for a safer home, and we all understand that. Sometimes people, the public especially, says, really? You know, and so I think we need to examine everything, quite frankly, to determine where these soft costs are playing an undue role in the cost of our homes, construction and or ownership.
Yeah, they're called soft costs, but they cost hard money, right?
So that's exactly right.
What kind of impact do they have on housing affordability?
Well, I look at, for example, lot development. In recent years, we've seen a lot of things that have happened. Many communities will add a cost per lot for the availability of a green space or park area in a development. We see other costs that are implemented. Sometimes it's in the development costs for street lights, et cetera. And there's always been the cost of development have always included, for example, installing a street, extending utilities. That's always been a natural part of lot development. But it's all these extras that have come into play that at one point were generally assumed by the community. And as the community expanded, they would then expend the money that was necessary for the parks. And now they're seeing this as a source of revenue and adding it to the costs of the development. So as a result, if I go back to when I was the mayor of Laverne, we had not had any new residential lot development in Laverne for roughly 20 years. And so when we became the site of the Veterans Nursing Home, we bought extra land and actually developed some residential lots. Those lots at that time sold from $12,000 to $14,000, $15,000. Today, lots are selling from $40,000 to $70,000. Now in Laverne, being a smaller community, we're roughly 5,000 people. We don't have a lot of the extra fees that we see having been developed in the suburban areas to the metro. And so as a result, it's not unusual to find residential lots up here, just a basic lot, nothing wooded or with and the aesthetic features that would distinguish it for selling for $100,000 or more. And so, and by the time, you have a $100,000 lot, you have a 1,500 square foot house. Now you've added almost $70 a square foot to the cost of that house. And so it gets to be a challenge.
Where is that money going? Who's seeing the benefit of that?
In most instances, I would say that it's going into the general fund, and so all taxpayers of the community should be seeing a benefit of it. But then there are other features, for example, such as building inspector costs. A community has to have a building inspector to ensure that the home is being built to code. We've seen some of those costs raised substantially. And originally it was always the intent of enabling legislation that those kind of costs were to cover the cost of providing the service. It was not supposed to be a profit center for a unit of government. And I think sometimes as we look at those costs, one has to question whether that is being used as a profit center.
To that end, you've authored Senate File 4749, which is bipartisan, and it's a task force on housing, taxes, and fees. So talk to me how that is part of this conversation.
Well, I think we talk about these things in general, and so but the conversation becomes somewhat disjointed. We talk about this part of it over here. If you get into building codes and what have you, now you're talking with the Department of Labor and Industry, and if you get into park development or some of the issues revolving around water, et cetera. Now we're into a different state agency. And I think by themselves, they look somewhat innocuous, but as you start to add all these costs together, all of a sudden the price tag becomes substantial. And I'm not trying to blame local governments here. I mean, I served 16 years as a councilman and a mayor. So quite frankly, as we look at these type of things, a lot of it is because of the mandates and the rules and regulations that the state passes down. And particularly now we also included in this legislation talk about fees and taxes. Quite frankly, it's no secret, anybody that owns a home, owns a commercial property, owns farmland, the increase in real estate taxes in recent years has been substantial. Now, I always used to tell people real estate taxes are nothing more, with the exception of commercial, industrial, and seasonal recreational, for which the state gets some money because of the state general levy that's applied against those kind of properties. Everything else is pretty much a summary of your local taxes. That would be city and or township, county, school district, maybe watershed, a few other ancillary things. And to many and that the state is not responsible for those. However, as a result of the last 3 years, I can no longer say that. With the mandates that the state has placed on our schools, the shifting of costs of government-provided services from the state to our counties, quite frankly, the state legislature is now responsible for much of the current increase in our real estate taxes. And it is our local units of government that are going to take the blame for that. But quite frankly, I personally believe that blame belongs up here in St. Paul.
What do you hope to accomplish with this task force? Do you want to suss out some of the areas where those costs are not going to cover services?
I would hope that the next legislative session would be able to take this information and, number one, reevaluate its own responsibilities in this increase of costs. And then also work with our local communities to say, okay, what are we forcing you to do that is making you have to charge these kind of fees for this kind of development? And hopefully manage to bring the cost of these fees down. I think that the next legislature, and of which I will not be a part as I am retiring this year, we'll be able to take a look at what is accumulated here. And actually, I think for some people it will be eye-opening to see what the total cost of these fees actually are in the price of a new home.
There are lots of agencies here based in St. Paul, state agencies, that could gather this information, like the Department of Revenue or the Housing Finance Agency. So why would your task force be a better place to gather this info?
At this point in time, I've never seen a collection of that information from all these different agencies. And I think what it's going to take is a legislative committee to say, okay, you bring us what your costs are, you bring us what your costs are, and actually put them together. And also at that point in time, it provides the legislature what should I say, an unbiased view because of the people that have been involved in the process. I think sometimes governmental agencies can become somewhat defensive and maybe even as a legislator, it's sometimes hard to get the data that you ask for.
Final question to you, sir.
Yes.
If you had carte blanche to solve Minnesota's housing crisis, what would you do?
The first thing I would do is, at the state level, is evaluate every program that's out there and every rule and regulation that we have passed that affects local units of government, that affects the construction trades, and start there. And then I would reach out to local units of government and say, now you need to do the same thing. And state's really good about going to local units of government and telling them what to do, and not necessarily doing it themselves.
Senator, thank you for the conversation, your time, and your service here in the Senate.
You're most welcome. Pleased to meet with you.
That's all the time we have today. Thank you for joining us, and see you next time.